Check. Go ahead, it's your turn.
Okay, what to do, what to do.
Is everything okay? What's going on?
Well, I'm a little dizzy. I think it's the wine.
You okay? David, what? Gee, what is going on? You okay? What's going on? You okay? David, do you hear me?
I think I drank too much wine.
Okay, let me see. Your face and your hand. Okay, I'm gonna run over there and get my phone. I'll be right back.
Hey.
Yes, I'm calling because my husband, there's something going on with him, like his face is kind of going down in his arm, and I need somebody to come really quick. Come in. My husband is in there.
Okay. All right, I'm Doug. I'm with the ambulance. We're gonna get some stuff out of the way so we can take care of you, okay? Okay, David, we're gonna go ahead and do some checks on you here, see how you're doing, all right? All right, I see you're having a little bit of trouble with your left leg, so I'm gonna help this time, okay? I'm gonna reach down right here and lift up both your legs, and I'm gonna let go. Here we go. I'm gonna reach up here and grab your arm. Can you feel me squeezing your arm? You can? You feel me squeezing this one? Last thing, sounds kind of silly, but can I get you to say, you can't teach an old dog new tricks? That's okay, that's good enough. We're currently on scene an ambulance call. We've got a 58-year-old male patient. We're going to make this a stroke alert. We're going to request an ALS intercept on this call. And also we are just packaging him up, and when we get to the squad we'll call with an ETA and we'll make direct contact with the intercept team. Do you have any questions for me? All right, David, we're going to go ahead and start heading towards the hospital. Are you comfortable the way you're laying? Is that okay? All right, I'm just going to take a minute and I'm going to call the hospital one last time, let them know that we're actually on our way, give them one final report, and then we'll get going up there and get you taken care of, okay? This is Mini Rescue 1. We are just getting ready to depart with our 58-year-old male stroke alert patient whose race score is still 9. He does have the last known well is still at 20/30, and he continues to have the facial droop and weakness on his left side. Got a pulse of 96, respiration's 28. BP is still 200 over 104 with a blood sugar of 120. We've already contacted ALS and we're going to be meeting with them here shortly. I would anticipate that we'll be arriving in about 15 minutes. Do you have any questions for me? Okay, we'll see you shortly. Thanks. All right, David, the hospital knows we're coming and they're going to take good care of you once we get up there, okay? So it'll be a quick ride. And we may have a couple other people jump in with us that might start some IVs and stuff, but we'll see what they want to do once they get there, okay?
Okay, we got Mr. Johnson here. This is a 58-year-old male. We got a 9 race score, 20/30 last known well. We got left side facial droop and weakness. We got a 96 pulse, 18 respiration, 120 blood sugar. The wife's en route, should be here in just a few minutes.
What was the last blood pressure?
That was 180/90.
And any other changes?
Nope, no other changes.
Mr. Johnson, we have a lot of things going on. A lot of things are going to happen at the same time. I'm going to poke your finger for a blood sugar.
Mr. Johnson, I'm Dr. Jarrett. Can you tell me how old you are? What month is it? Follow my finger with your eyes. Look at my nose. How many fingers do you see in your periphery? Close your eyes for me. Open them. Can you smile? Let me see your teeth. Can you lift your arms up? Let's hold them for 10 seconds. Okay, relax. Same thing with your leg, one at a time. Lift this leg for me. Can you hold it? Okay, relax. Lift this left leg for me. Can you feel me touching you here? How about here? Repeat after me. Today was a sunny day. Let's go to CT, guys.
We have Mr. Johnson here for a stroke alert. The order for CT is already in.
Mr. Johnson, we're going to get you moved over to the CT table.
Can you grab your glasses here, Mr. Johnson? Okay.
We're going to have you roll towards me.
Okay, countdown.
We're going to move on 3.
1, 2, 3.
Mr. Johnson, my name is Sherry. We're going to take some images of you. I'm going to start to move the table into the machine. You just got to hold still and breathe normally.
Okay, so it looks like the CT is negative. I don't see any bleed. Let's get a CTA.
Okay.
Let's initiate the transfer process and get the thrombolytics ready.
Sherry, we're going to do the CTA.
Okay.
All right, so we've got you hooked up to monitors. I'm gonna grab your blood pressure real quick.
I'm going to hook you up to the IV. Oh, look, Mr. Johnson, look who's here. Is this your wife?
Hi, David.
Hi, Miss Johnson. I'm Dr. Jarrett. We're just getting back from the CT scanner. We're waiting for the radiologist to give us the final reads. We think that your husband may be having a stroke. We've already started the transfer process to send him to a facility with a higher level of care. They can do things like thrombectomies, where they go into his brain and take out a clot if that's necessary. Okay. I'm just going to ask you a few clarifying questions, if that's all right.
Okay.
When's the last time that you saw him normal?
8:30 tonight.
About 8:30 tonight. And he typically takes warfarin for his blood thinner. has not been on it for the last several days for an
Right.
upcoming procedure. Is
Yeah.
that correct?
Yeah, that's
Okay.
correct.
Does he have any history of recent trauma, strokes,
No,
any head bleeds,
no.
recent surgeries or procedures? Okay. Excuse me. So this is the radiologist. Hey, this is Dr. Jarrett. Okay. Negative for hemorrhage. Thank you, guys. So the radiologist said that there's no bleed.
Oh,
He is eligible for a medication that can help break up a clot in his brain that should hopefully restore some of his function. There are some risks to this medication, but we can discuss that in detail before we do the procedure.
okay.
I know you're going through a lot right now, and I want to take a moment to explain what's happening and the options that we have. Your husband has been diagnosed with an acute ischemic stroke, which means that one of the blood vessels in his brain has become blocked, cutting off blood flow to part of his brain. We need to act quickly to reduce any further damage. One of the treatments we can offer is a medication called thrombolytics, or a clot-busting drug. This treatment has potential benefits, but also risk I want to share with you so you can make an informed decision about what's best for him. The main benefit to this medication is that it can break up the clot, blocking blood flow in his brain. If we give this medication early enough, typically within 3 to 4.5 hours of onset of symptoms, it can improve his chances of recovery. It can help restore blood flow to the affected part of his brain and reduce the amount of brain damage, which may lead to a better recovery, less disability, and a quicker return to normal life. Thrombolytics are a powerful medication, and while they can be very helpful, they also come with some risk. The main risk is bleeding, including bleeding inside of the brain, which can be very serious. I want to emphasize that while thrombolytics are not without risk, the window for giving them is small, and the potential benefits are significant when given in time. We'll work with you to weigh those risks based on his condition, medical history, and how long it's been since his symptoms started. Do you have any questions or concerns about this treatment? I'm here to explain anything further, or we can discuss other treatment options if you're not comfortable with thrombolytics.
Are you okay with us giving that medication?
Yes, just do whatever you have to do.
Okay. Can I get an INR and a weight for him, please?
Yep, INR just came back. It's 1.2 and his weight is 90 kilos. And I'll go ahead and call pharmacy to start the mixing process.
What questions do you have for me?
I don't know. Just, is he going to be okay?
We're going to do everything we can to give him the best care that we can, okay? If you need anything from me, please let us know, okay? All right, thanks. All right, Mr. Johnson. Okay, all right, got it, thank you. So the CTA is positive for a large vessel occlusion. Let's proceed with transfer, okay?
Okay, thank
All
you.
right, thanks.
Hi, this is Nick calling a report on a patient that's transferring for thrombectomy. We have Mr. Johnson, 58-year-old male, came into us tonight for concerns. All right, we have Mr. Johnson here. He's a 58-year-old male that came in this evening for concerning for stroke, presented with the left-sided facial droop and weakness, did have a race score of 9, and his last known well was at 8:30 p.m. When he got here, we did do a head CT, and it was negative for hemorrhage and a CTA that showed a large vessel occlusion. We did proceed with giving him IV thrombolytics at 22:02, and we did have to treat him one time with labetalol prior to giving the medication. We're 1 hour into his check, so he will need another hour of Q15 blood pressure, all his vital signs and neuro assessments, and then Q30 after that. His current vitals are 165/83 for blood pressure, pulse of 78. He's been setting fine on room air, and then we do have an 18 gauge in his AC over here, and that'll be locked off for transport. Any other questions?
Not at this time.
Alrighty.
All right, I got him.